Hello there. Once again, it is a joy for us to be before you, especially today as we're having within our studios a very special guest and important man. He's been over the years an instrument in the Lord's hand, presiding over one of our greatest institutions in the world, the Loma Linda University. And we are going to talk about that institution, talk about what it does and its contribution to the mission work worldwide. It is my pleasure to present to you Dr. Hart Richard, President of the Loma Linda University. Well, it's an honor having you with us, Doctor.
Thank you. It's good to be here in Abidjan with you.
All right. First time in Abidjan?
It is actually my first time in Abidjan.
Right. Well, welcome. How do you enjoy the weather?
It's been good weather. It's been cool, so it's been nice. I used to live in East Africa, in Tanzania, for some years, and I traveled Africa a lot, but this is the first time to Abidjan.
All right. So welcome.
Thank you.
Well, for a quick start, could you please tell us more about yourself? You know, we have this saying in Africa, especially in Côte d'Ivoire, that the fresh water comes out of the mouth of the frog, meaning you are the most well-placed person to tell us more about yourself. Would you please tell us more?
Certainly. I grew up in northern Idaho, one of the states in America.
Right.
I did my medical training and my initial public health training at Loma Linda University.
Okay.
And I went back to Johns Hopkins University and did a doctor of public health degree.
Right.
And then I spent 4 years in Tanzania working within the government, developing a national maternal and child health program.
4 years.
And then after that, I came back to Loma Linda and been there since 1977 in a variety of positions at Loma Linda.
1977,
Yes.
That's a long time ago.
It's a long time. That means I'm getting old.
You're a veteran.
I'm a veteran.
All right. Now, we know that the Loma Linda University is a prestigious university. What has made your institution earn such a great name?
Well, first let me explain a little bit about what makes up Loma Linda.
All right.
We actually have changed the name recently to Loma Linda University Health.
All right.
Because Loma Linda is really what's called in America an academic health science center.
Okay.
It's one of about 145 institutions like this in America.
Okay.
That means it's made up of a university with 8 professional schools,
Okay.
a system of 6 hospitals, and a faculty medical group with approximately 800 doctors of specialists of all kind.
Right.
So those pieces make up Loma Linda University. Around 15,000 employees. We see around 1.5 million patients each year.
Wow.
We have almost 5,000 students training in a variety of health science programs.
All right.
So that's what makes up Loma Linda. We're 110 years old now. We started in 1905. So we've been around a long time and have sent graduates all over the world, including to Côte d'Ivoire and all over West Africa. Have worked in the various hospitals and programs here in Africa.
All right. Well, you mentioned something about your students that you send in all the world, especially in Africa, West Africa, even in Côte d'Ivoire.
Yes.
Right? Well, I'd like to know, because there are some other institutions, like prestigious institutions, that produce good students as well. Would you tell us what will be the difference? What is the difference between students from other universities and students from Loma Linda?
Loma Linda University is owned by the Seventh-day Adventist Church.
Okay.
And although many of our students come from other faith traditions, other Christian denominations,
Okay.
and other non-Christian denominations, we have a significant number of Muslims,
Yeah.
we have Hindus, we have Buddhists, we have others that study at Loma Linda. But we put an emphasis on faith and a commitment. I mean, a spiritual dimension, whatever religious background a person comes from,
Right.
we believe there's value in enhancing their spiritual commitment and compassion.
Right.
We have core values at Loma Linda that we talk about, and there's 7 of those: justice, compassion, humility, integrity, excellence, freedom, and self-control. So as a faith-based institution, we believe we have not only the right, but the obligation to look beyond just technical training, but to give professional skills, professional understanding to our students so they can be complete in themselves and share that with their patients or communities.
All right. Now, do you think that having a prestigious institution and producing good students is enough in bringing hope within the city where the Loma Linda University is, the States and worldwide, more specifically in Africa?
Well, it's an interesting question because about 15 years ago, we recognized that sending our graduates out to work around the world was good, but perhaps not enough by itself.
Okay.
And so as a result of that, we've started partnering with many hospitals in different parts of the world as well. And that's why we're here in Abidjan today. We're having a seminar to help strengthen our hospital partners. There's approximately, I think, 18 hospitals in West Africa owned by the Adventist Church. 18. And so many of these are represented in this conference here to where we're looking at ways we can make those hospitals stronger, both clinically stronger, but also financially and management-wise and so on. So that's another contribution Loma Linda is making is through that process. We've actually formed an organization we call Adventist Health International that I also serve as president of that helps to facilitate our relationships with these hospitals.
All right. Now, do you know of any hospital in Côte d'Ivoire?
You're not supposed to ask that question because we don't have a hospital in Côte d'Ivoire. And I've been asked that for quite a few years now. And we actually have had some planning take place while I'm here now. As the time comes, we need to start a hospital in Côte d'Ivoire.
Good news.
There's 5 in Nigeria, there's 7 in Ghana, we have 3 in Chad, we have 1 in Liberia, 1 in Sierra Leone, but none in Côte d'Ivoire.
None in Côte d'Ivoire.
So perhaps it's time.
All right. Surely, I'm sure it's time, and we thank God for your coming here. Well, Dr. Hart, could you tell us a bit more about your job as the Loma Linda president? What is your day like?
Well, my day is very full. I serve as a president and CEO of the entire complex of Loma Linda. So I call myself a professional committee member because that's what I spend most of my day in committees of different kinds. So we have 8 schools. Among the schools of the university are medicine, dentistry, pharmacy, public health, allied health professions, behavioral health, and School of Religion make up the schools of the university. Then we have 6 hospitals, including a children's hospital, a rehabilitation hospital, a psychiatric hospital, and so on. Make up the 6 hospitals, and then there's 800 and some doctors of all different specialties, including we have 700 doctors in specialty training. So we have a medical school of about 700 doctors. We have a specialty training for about another 700 doctors. And then there's about 800 doctors on the faculty that teach on the staff there.
That's huge.
So it's a big medical complex and doing a lot of interesting things. One of the things your audience here may remember was what's called Baby Faye. In 1984, you're not old enough probably. In 1984, in Loma Linda, Dr. Leonard Bailey performed the first heart transplant with a baboon heart. Where they took the baboon out of a part, put it into a little girl whose heart was deformed from birth and couldn't live. And that was the first infant-to-infant, or baboon-to-infant heart transplant. And that girl didn't survive, although the transplant went well. And since then, Loma Linda has become the largest transplanter of infant hearts in the world. They've now transplanted about 800 hearts. These are usually children that are just a day old that have a deformed heart from birth. And then if they can find a donor heart, they can put a new heart in that baby. So that's one of the things we're known at around the world is Baby Faye is the name of that first baby. But it's gone on to many, many more successful transplants.
All right. So you're pretty busy, actually. Well, if I understand, we have the Loma Linda University, the campus where people study, and we have the hospital on the same big compound, right?
Well, there's actually 6 hospitals. So there's 2 of them right there on the main campus. Then there's another 3 just down the road a little ways. And then another one about 25 miles away.
All right. So. Now, do you still perform as a physician in any of those hospitals?
I do. I still see patients a half day a week. But I still try to hang on to my clinical skills and do something. I enjoy that.
All right. So you're not just in the office, actually.
Yes.
You're on the field. Well, now about some public health issues like diabetes, hypertension, and all that. What is your view as a doctor, and how could they be avoided?
This is one of my biggest concerns. I've been traveling in through Africa now for almost 45 years.
Wow.
And during that time, Africa's gone through a lot of changes.
Okay.
When I started working out here, we were dealing with malaria and tuberculosis and diarrhea and polio and many of the even smallpox. When I was here, we were just eradicating smallpox.
Mm-hmm.
Now Africa it still has many of the infectious diseases in the rural areas, but in the cities, we've now become a population of Western diseases, where we're starting to pick up all the diseases we have in the U.S. and Europe: hypertension, diabetes, heart disease, and so on. There's several reasons for that.
Okay.
Number one, Africa has moved away from its traditional diet, which is more of a plant-based diet, to a Western diet, more fast foods, fatty foods, more
fats.
meat, and so on.
Yeah.
So that's contributed to cholesterol problems.
Yeah.
The incidence of smoking has gone up in the cities, so we have a problem with smoking.
Yeah.
We don't exercise as much. We get many conveniences, so we don't walk as much. People drive everywhere, so we're gaining weight.
Yeah.
So when you put those things together, we've started creating a ticking time bomb among the upper elite in Africa, where heart disease and diabetes and all these things are starting to come along. Yeah. And so it is a major concern and one of the issues we need to face for the future.
Well, how could we avoid that?
Well, it's a combination of things. These are what we call multifactorial diseases.
Okay.
And so it's not just a single cause. I mean, people have genetics that make them susceptible to diabetes and hypertension.
Genetics.
So you need to be careful to pick the right parents before you're born, so you don't pick up those genetic traits. And we can't do anything about that, so we inherit them. Our lifestyle. I mean, we clearly cannot afford. The human body is meant to be active.
Okay.
And when we move into an affluent lifestyle where we don't get much exercise, where we get a lot of rich foods, our bodies put on weight. And that's one of the biggest problems. There's a direct correlation between diabetes and weight gain. Right. So if you can lose weight, you usually can help oftentimes control and even cure both diabetes and high blood pressure just by losing weight.
So can we say that people with obesity are more exposed to diabetes?
Absolutely. There's a high risk of diabetes from that.
Wow.
Yes. So those are all variables, and yet that's kind of every capital city in Africa. As I walk through it, I mean, you walk through America now, and half of America is obese, and we have an epidemic of diabetes going on. Wow. Now you come to the cities of Africa, and you start seeing the same thing starting to happen, and you wish somehow we could avoid going down the road that we have in America.
Yeah. Well, sometime last year, Africa, especially West Africa, has been shaken by the Ebola crisis. Now, has the University of Loma Linda contributed in any way to fighting against Ebola?
Yes, very much so. We have two hospitals, one in Monrovia, Liberia, capital of Liberia, and we have a hospital in Freetown, Sierra Leone, capital of Sierra Leone. So when this epidemic hit, we immediately started mobilizing these hospitals, preparing them for dealing with Ebola. In Monrovia, we were the only hospital that stayed open when all the other hospitals closed, because the hospital workers were afraid to come to work. They were afraid to get exposed to Ebola. And our team at Cooper Memorial Hospital, we call it in Monrovia, says, no, if you send us the equipment, we will continue to see patients. And so we continued that on. In Sierra Leone, the government took over our hospital to serve as an Ebola treatment unit. So we're just getting it back now. So it served to treat Ebola patients. The hospital in Liberia we tried to treat the non-Ebola cases. Because if you think about it, Monrovia is a city of 1 million plus people. There was many more people dying of other causes than Ebola. I mean, the high-risk pregnancies, the complicated deliveries, the traumas, the malarias, all that kept on going even with the Ebola crisis. So our hospital became specialized in taking care of all those kind of cases during the Ebola epidemic.
But were your workers afraid of the Ebola, though?
They were afraid, and we lost some workers from both of our hospitals. We lost several workers. We're not sure whether they got exposed in the hospital or in their villages or communities, but we lost some workers and had to temporarily close the hospital, kind of sanitize it, go through quarantine, and then reopen again.
All right. Well, it's pretty sad, but I guess there's some good side to it somehow, because some people have been kept safe because of that.
Certainly. We've kept a lot safe. We've also learned that we need to strengthen our public health infrastructure. Much more than we have in these countries.
Now, how about, what do you think of the HIV/AIDS in Africa and what could be done?
Yeah. I've been working with HIV/AIDS for many years. It's, of course, much worse in East and Central Africa than it is in West Africa.
Yeah.
We still have countries over there that are running 8 to 10 to 12% of the population
Wow.
are HIV positive. In our hospitals in East and Central Africa,
Yeah.
60 to 70% of all the hospital patients in the hospital
Yeah.
are HIV positive.
60 to 70%.
60 to 70%. They come in with tuberculosis or malaria
Mhm.
or things like this, but because their immune system is knocked down because of HIV/AIDS,
Yeah.
then they're susceptible to infections. But it's a high percentage. So we have to assume basically every patient we see could be HIV positive. We're making progress. I mean, the
Right.
epidemic has started to taper off in Africa.
Yeah.
Unfortunately, it's not growing the fastest in China and in Russia.
Okay.
And to a degree in India. These countries are starting to take off a bit more. But in Africa, it's starting to taper off. But we still have a huge burden of disease that will infect us for many generations.
Yeah, but it has the Loma Linda University, is the Loma Linda University involved somehow in the fight against AIDS?
Well, we have had a lot of people in the field doing this. We've had some research going on, as many universities in the States, looking for vaccines or looking
Right.
for ways to try to deal with HIV/AIDS.
Yeah.
No one's come up with a solution yet. So the best thing is good counseling, trying to avoid exposure to the disease.
All right. Now, Doctor, in Africa, we sometimes use natural remedies like plants, we just grind them and apply them on our skins or drink some beverages from plants and so on. But some other people go to voodoo, go to charlatans and all these things, and they get well. Now, what is your view about that? What do you think about that?
I mean, it's clear that most diseases go up and down if we do nothing.
True.
Many infections, the body will get over them, so you get an infection, and about the time you say, okay, I've got to do something about it, the disease was going to get better anyway. So whatever you did gets credit for making the disease better, when in fact it would have happened anyway.
Yeah.
So it's very difficult to know cause and effect when you're treating diseases.
Right.
It's also true that a lot of the natural remedies that have come about through time in these countries have an effect. And many times they're not as powerful as modern medicines, but they have some value.
Yeah.
So I don't discount any of those things. I think they have value. Some of the traditional healers probably have some things they do. Many of them are excellent psychologists. They play with the mind and have an impact that way.
Magnetism there.
So I don't like to discount anything. I think there is no substitute for quality modern medicine for many of the diseases that we face today.
All right. Well, about the medicines, in Africa, sometimes people would not take into account the expiry dates written on the medicine, on those boxes most of the time. Can you tell our viewers the importance of expiry dates?
Expiration dates are important on medicines, and particularly in a country like Cote d'Ivoire, where humidity and heat and many times affects them.
Yeah.
Sometimes these medicines sat in a warehouse before they come to the
True,
pharmacy.
true.
So all those issues are there. And they lose their potency. They don't go from full potency to zero in one day, obviously, but they start going down after that expiration date.
Yeah.
So it is important to look at that and make sure that it's a fully potent medicine before you gamble your life on taking it.
All right, thanks for your advice, Dr. Hart. Well, we know that the Global Healthcare Conference is going on, organized by your university. What is this conference about?
This is an attempt to bring all of the Adventist hospitals throughout West Africa together. We're looking at everything from quality of patient care to accounting practices, to adequacy of equipment, to adequacy of medical supplies, to management techniques, to educational programs for quality staff, and so on. So it's a strategy. We do this periodically around the world to try to upgrade those. And then every other year we bring people from West Africa to America, to Loma Linda, where we have another conference there. Right. So it's our effort to continue to strengthen the operations in these institutions.
All right. Well, Dr. Hart, what would be the last word if you were to say one more thing to all these people that are watching us about the mission work of Loma Linda?
Well, I consider it a privilege for Loma Linders to be involved with the world. Many times we get the idea in the West that somehow we're helping Africa or we're curing disease. It's a tremendous blessing for us because it's the only way I have to give my students, my graduates, a chance to engage with real issues and to feel the sense of satisfaction that comes from working with others.
Sure.
So thank you, Africa. Thank you, Côte d'Ivoire, for the privilege of working out here and being able to assist in the institutions in this great area of the world.
All right. Well, thank you very much, Dr. Hart. We know we stole a little bit of your precious time. Thank you. It was an honor having you with us. Well, it has been a pleasure for us to have Dr. Hart, the president of the Loma Linda University, and we hope that it has been a blessing for you too. Till then, may God grant you good health in Christ's name. Amen.